Checking for an abdominal separation or diastasis is an important task that a pregnant and postpartum soldier will perform. Knowing how large the separation is, especially postpartum, affects exercise techniques and progression. Your job as exercise leader is to teach soldiers how to check for separations, and then show soldiers how to alter their exercises because of the diastasis. To check for a diastasis after the first 20 weeks of pregnancy, have the soldier lie on her back. This temporary position is okay for the check. Have the soldier do a regular curl-up. A bulge along the midline of the abdomen is a separation or diastasis. Also, remember that the pregnant soldier must splint her abdomen during curl-ups and curl-downs to protect the widening of a diastasis. If the bulge widens during exercise, check the soldier's splinting technique. If it still widens even with a good splinting technique, have her discontinue the exercise and follow up with her healthcare provider for exercise guidance. The soldier can also learn how to check for a diastasis postpartum. You teach her how to do this while she's pregnant and then explain to her how she'll do it when she's at home on convalescent leave. For a soldier to check for a diastasis postpartum, she first lies on her back. Using her fingertips, she locates her belly button. Then, while doing a curl-up, she moves her fingers an inch or two above the belly button, looking for an indentation between the rectus muscle bellies on either side of the midline. Next, she determines the width of the indentation by seeing how many fingertips she can fit into the space. She then repeats the steps an inch or two below the belly button. If the space is 2 fingers or more in either or both locations, she has a separation or diastasis and must splint during head lifts and or curl-ups until the separation improves to less than 2 fingers. This improvement usually occurs by 6 weeks postpartum. Remember, if it does not, she should continue to do head lifts and curl-ups with splinting until her healthcare provider authorizes her to progress to Army sit-ups. If the separation is less than 2 fingers and the soldier can correctly do 3 sets of 10 curl-ups by holding her abdomen flat while doing the exercise, she can progress to Army sit-ups.